Hey everyone, welcome back. My name is Kelly Troutman and I am a certified hand therapist. And today I am going to film two videos, I think kind of back to back. The first video, so the video that you are watching right now, is about TFCC tears for patients or for people who have a TFCC tear. So if you have painful wrist, you've been diagnosed with a TFCC tear, stay right here. This video is for you. If you are a therapist, a hand therapist, OT, PT, anything that you want to know about how to treat a TFCC tear, or maybe you're a therapist and somebody in your family has a tear, stay tuned. The next video is going to be for you. But you can also watch this because you might learn things that you might need to know. So anyway, this video is meant to be a quick review of TFCC tears, what to expect in therapy, and what the treatment might look like, because obviously you have a ligament tear. It's not something where we can magically touch it and make it go away. It's going to take time for it to heal. But if your doctor recommends therapy, this is what you might expect to find in a hand therapy clinic for your injury. So let's do it. First things first, what even is a TFCC tear? So TFCC, we call it that because the actual name is quite a mouthful. It's triangulofibrocartilaginous complex. It's really hard to even get through it without stumbling or stuttering, so that's why we call it TFCC. It is a really important ligamentous structure that helps to connect the bones on this side of the wrist, on the ulnar side. It also offers a lot of stability and support. Usually when you have a TFCC injury, things that are hard for you to do or you have pain or popping with are going to be movements where you're rotating, like supinating, pronating, sometimes even doing deviation, right? Ulnar and radial deviation, and a lot of times weight bearing. So putting weight into the hand will cause a lot of pain in that area. Of course, a doctor will be able to diagnose you, and you should definitely go see a hand specialist or at least a primary care physician if you are having ulnar wrist pain. When that ligament tears, there can be a whole lot of problems that happen with the wrist, and sometimes they'll heal on their own and sometimes they won't. There's a portion of the TFCC that does not have very good blood supply, so it often doesn't heal on its own. But if the tear is in the peripheral portion, a lot of times the surgeon or the doctor will kind of sit and wait and kind of watch you as you heal over the next like 6 to 8 weeks to see if it's getting better on its own, or if they want to do a surgery or another type of procedure for that. So that's basically what a TFCC tear is. I get asked from a lot of my TFCC patients, why is the doctor having me go to therapy if it's just going to take time to heal? And there are things that hand therapists can do to help you along the way with your recovery. Even though we can't necessarily like fix the exact problem, there are a lot of things we can help to support you with your recovery and help allow you to function in your daily life and restore normal movement and function and strength. There are basically three main phases of your rehabilitation process or of conservative treatment. Phase number one is getting the pain and the inflammation to calm down. So they're going to use things like modalities like ice, like heat, manual treatments, using splinting or different, immobilization techniques, so things like braces or even maybe like a wrist widget or something, things to help calm the inflammation down. Once the pain and the inflammation starts to go away, phase two is restoring normal movement of the wrist, right? We want to be able to get you moving in all the directions that the wrist can move with comfort. And then once you've got normal motion, phase three is the strengthening phase and returning to normal function. So that's when a therapist might be working on stability, proprioception, a lot of different strengthening type of exercises to help promote stability of the wrist and balance of the wrist, because a lot of times what happens after a tear is things get a little bit out of sorts in the wrist, and so we lose a little bit of that stability that we have, and so certain activities can be really difficult because it almost feels like the bones are kind of pulling apart. A lot of times, therapists might recommend like a wrist widget, especially for heavy activity, because it will help keep everything compressed while you're doing the movements. So that's a pretty cool tool that you can try. Definitely check that out because I've seen it help a lot of people with TFCC tears. But those are basically the three main components, right? We've got our inflammation control, restoring normal movement, and then restoring the strength and function. So that is a basic overview of what you might expect from a rehab program or a hand therapy program targeted to treat TFCC tears on a conservative treatment method. So that means you haven't had surgery yet, right? Obviously, I should have said that in the beginning. Um, but yeah, this is kind of what to expect if you have not had surgery and things that they might focus on in therapy. I hope this video was informative. If you would like to know more about this topic, or if you want me to talk through some different exercises or different kind of activities that you might expect in each phase of treatment, please comment below and I will make a second video if you guys are interested in that. Give this video a thumbs up if you enjoyed it, and please subscribe to the channel so you don't miss any more hand therapy content. And let's talk soon.